COVID-19 cases have surged from around mid-April to the first week of May. Doctors that CNA spoke to say weaker immunity, post-pandemic travels and a lack of testing are some reasons for the increase, but they assure that the rise is not a cause of concern. Nadine, Yeam and Nasyrah Rohim with this report.
In the first week of May, a daily average of about 2,906 polyclinic patients showed acute respiratory infection symptoms. 17% of them had COVID-19. 2 weeks before, only 9% from 2,749 cases were recorded. That's according to the data compiled by the Communicable Diseases Agency. This is far from the tens of thousands of weekly COVID cases during the peak of the pandemic. Doctors CNA spoke to say one reason behind the rise could be a weaker immunity as the COVID strain mutates.
Majority of the patients actually have not been vaccinated since the past about 1 to 2 years, and most of them had the vaccine. The last vaccine, probably some it can be more than 2 years. And with the drop in the immunity of the COVID infection, they are more vulnerable.
According to the Health Ministry, anyone deemed as fully vaccinated against COVID-19 must have at least 2 doses of any of the vaccines under the World Health Organization's emergency use list. And even amid the rise in current COVID cases, local doctors are still following the Health Ministry's guidelines, and that's treating COVID as an endemic disease, just like the common flu. Doctors also cite other reasons for the rise in cases.
Travel has increased without much checks, and many people think that COVID is over and they're not testing themselves when they have COVID-like symptoms. A lot of the patients who are tested at our clinic was because they have company insurance coverage for COVID testing, and many other patients, they are not keen to pay for COVID testing.
While the current situation is under control, doctors still advise Singaporeans to be aware of their symptoms should they fall ill, and to seek treatment early.
If they can, actually try to isolate from their family members, which is actually the most vulnerable, and they spend the most time with them. So chances of passing on to family members and close friends, which is higher.
Doctors also advise people to wear face masks if and when feeling unwell.